Hi, I'm Francis, the official mascot of Broadway Pet Hospital. Today, let's talk about something that shows up a lot in spring and summer. Ear disease in pets. What is ear disease really? Many people think of it as just an ear infection, but that's not always the case. In fact, the most common cause of ear disease is skin allergy, because the ear is made of skin. When the skin is inflamed, the ear canal becomes inflamed too. Bacteria can take advantage of this and cause an infection, but in a healthy, non-allergic ear, that usually doesn't happen. Why does this matter? Because if we treat only the infection without addressing the underlying allergy, the symptoms will come back again and again. Understanding that ear disease is usually part of a larger skin allergy issue helps us focus on treating the root cause. So what causes allergies? There are three main types of allergies in pets: flea allergy, food allergy, environmental allergy, also called atopy. And here's something important. Having one type of allergy doesn't protect a pet from having the others. Ear disease is a feature of all three types. How do we figure out which type of allergy your pet has? We look at four main clues: age of onset, when did the symptoms start, seasonality and consistency. Are symptoms worse at certain times of year or always present? Distribution of symptoms. Where is the skin inflamed? Where does your pet lick, chew, or scratch? Response to treatment. Did anything help? Let's take an example: a puppy with an ear problem. If a puppy comes in with discharge in the ear and is chewing near their rear end, we immediately think of fleas. But we also consider food allergy and sometimes ear mites. Ear mites are much more common in kittens and pretty rare in adult dogs, but still worth checking in puppies. So how do we examine the ear? We look inside the canal and check the amount and color of the discharge, whether the canal is red, swollen, or normal. Here's an important note about ear discharge. It's not dirt. It's not something that got into the ear from outside. It's something the diseased ear is producing. The ear doesn't need to be scrubbed. It needs treatment. We sometimes use ear cleaning solutions to soften the discharge, but the goal is to reduce inflammation and infection, not just to clean. How do we find out what's in that discharge? We collect a sample, place it on a glass slide, stain it, and look at it under the microscope. This is called an ear cytology. What can we find? Usually one of four things: normal skin cells, yeast, a type of fungus, rod-shaped bacteria, cocci-shaped bacteria, round. The treatment we choose depends on what we see under the microscope. But again, the real key is treating the allergy first step, flea prevention, always, even if we don't see fleas. Why? Because seeing fleas is hard, especially if there aren't many. And with flea allergy, just a few bites can trigger severe symptoms. The most effective flea medications today are oral pills. Why? Because they're newer, and fleas haven't built up resistance yet. Over time, flea populations adapt to older treatments, but newer drugs usually work better, for now. Second step, control environmental allergies. We do this with medications like Apoquel, Zenrelia, and short-term steroids. Topical steroid treatments inside the ear are also very helpful, and they have very few side effects when used correctly. What if nothing's working? Then we consider food allergy. It's a diagnosis of exclusion, which means we rule out everything else first. If a pet is on flea prevention and still has symptoms while on Apoquel or Zenrelia, then we do a food trial to rule out food as the trigger. We'll cover that process in a future video. Final thoughts. Ear disease is not just about dirt or infection, it's about inflammation and usually underlying allergy. Thank you for watching. Follow us for more pet health videos and updates. I'm Francis, the Frenchie from Broadway Pet Hospital. See you next time.